Dr. Vanek, you've been doing a series of live presentations called Dental Implants, the Bionic Tooth. Can you tell me about that?
Actually, yeah, there's a lot of stuff that we try to get out nowadays that we can't reach as many people as possible. So we hold these types of events where people can come in and, we talk to 20 people at a time about implants and just educate them, because I'm all about trying to give them free information and just to build on, what people in the public know about implants and the technology available to help them.
Doctor, let's talk a little bit about Invisalign and orthodontics for adults. You recommend that as kind of the first line of cosmetic dentistry.
Yeah, I'm a big proponent that anybody that does cosmetic dentistry should really be letting people know that orthodontics should be the first route. If you're happy with the color, the shape of your teeth, that should be number one on the list of options to pursue. And it's definitely something that we're really revolutionizing the way we do orthodontics so that adults can experience, the same benefits that the teenagers, used to get.
Dr. Vanek, technology in dentistry has come a long way, obviously, in terms of cavity detection, and then there's something now called gum tracking software. That sounds really interesting.
Yeah, actually, with some of the chair side type of things that we have set up in the modern dental offices, we're able to network computers easier and those things. So we're able to call out some of these codings that we have been using for years in dentistry. But now what's fun about it is we can track it over a longer period. So when people come in, we can do statistic analysis that the software does automatically, and it's color coded and very visual, because a picture's worth 1,000 words, and it really helps the patients understand what's going on with their gum health.
Doctor, let's talk a little bit about teeth whitening. And are there any myths that you want to bust about teeth whitening here?
Well, what's interesting is there's a lot of different ways to skin a cat, as they say, right? So It's one of those things that if you're experienced, and being from Orange County, I get a high demand for people who want the whitest, brightest teeth possible, down to the people that also, want it a little more natural. So there's a lot of different ways to do it. And one thing that's a common misconception is that laser whitening is something that's really unique and special. Really, all the bleaching techniques that we do are the same. It's just a variance of speed that we do it. And in my office, I really try to tailor individual to the patient, because if we have a young 20-something female patient, she's going to have very sensitive teeth if she gets that real laser boost type of treatment, whereas someone in their 80s, they're going to have different concerns. So it's really important to recognize that a good practitioner knows those differences and knows how to apply them.
Doctor, let's talk a little bit about how to keep your children cavity free. I mean, is that really possible?
Well, actually, it's surprisingly easy, and it really blows my mind as a dentist to see how many problems we have. And really, in the most affluent areas, the well-educated areas, I see even more problems. And let's face it, moms really wear the pants in the family. I know my wife does, and they're the ones controlling these decisions. So when I bring in a patient, even when she's pregnant, I'm always talking to them about what to do with their kids. And there's new things on the market, fluoride varnishes, coatings that we can do, sealants, and a lot of these steps, if done in the right order from really young age, it's really going to save heaps of money, time in the dental chair, and a lot of things like that that go into a person's long-term health status.
Dr. Vanek, it sort of seems hard to believe, but still today there are people who really fear a trip to the dentist. What do you do to alleviate people's fears?
Yeah, it's really shocking to me how much it'll affect someone and whether they're willing to go to the dentist or find one and then stay with them. And what I see in my office, I have patients that drive 2 hours through Los Angeles traffic, and I practice in Southern California, and it's something that amazes me how many dentists they must pass from where their home is to get to me, to just do what I think is the norm. But basically, you take someone who's had some bad experiences, and what you want to do is you want to start them off often with sedation dentistry. Now we can give pills to people that they can just be a little more relaxed when they come in. I offer nitrous sedation, which is laughing gas, and that's very convenient for the busy people because I can turn it on and turn it off within a minute. So if someone's, coming in at lunch and they have to go back to work, they don't want to have that sedative effect in their system. Whereas if we're doing a bigger procedure, obviously they can get picked up and taken home. But there's a lot of options, and if you have those tools in your tool belt, I think you really attract and kind of can do better dentistry for people where they're in a real more relaxed, trusting environment.